Where did the idea for Joy come from?
Yeah, so Joy is all about solving loneliness with technology, which is almost a sort of counterintuitive solution. And at the heart of the idea behind Joy was something that anecdotally I observed firsthand happening, which is that people who I really cared about, like family members, friends, loved ones, I noticed that particularly one person became increasingly lonely. That this is a person who'd I deeply cared about, and they lost their job, wasn't working anymore, and gradually sort of became a bit more lonely and isolated. Whenever I would chat to them, I'd sort of ask, how are you doing? What have you been up to? And what I noticed, I actually stopped asking that question. And the reason why is because it was painful. I felt like there wasn't really much going on for them, and it became a bit embarrassing and a bit awkward and whatnot. Typically, when you'd ask that question, it'd be about GP appointments, doctor's appointments, blood tests. I might be pre-diabetic or things like that and whatnot. And so what I experienced, this person's health suddenly declining, really motivated by the fact that they weren't working anymore. They'd become disconnected. Their social circle became smaller, and so I tried to help. So I actually started researching things that they could do in their area. So why don't you volunteer here, or why don't you start going to this? And always what happened is they'd be like, that sounds like a great idea, but nothing would ever happen. So I took matters into my own hands, like one Christmas, and I actually bought this person an art class. And what I've now learned is that I became a social prescriber. Nice. But that's not what I was thinking. I was thinking, I'm going to pay for something and sign you up. And it was had a transformational effect on their mental health and well-being all round, their physical health, emotional health. When I'd ring them up and ask, how are you doing? And there was something to look forward to. And the reality is that had an impact on not just their own well-being, but also on the health and social care system as a whole. And that's just one story.
Yeah.
But there are millions of people out there, so just like a few stats. I love stats. A few stats. Right, so here's just the most shocking. 9 million people feel chronically lonely. 1 in 5 people, amongst our generation, millennials, 1 in 5 millennials have no friends.
I remember you telling me that, and
Zero
I was
friends.
just shocked.
It's awful.
It's really bad.
And what this looks like and what it's manifests itself is that people waking up feeling miserable, and they have nothing to look forward to, and when things go wrong, when life takes its toll, there's no resilience there. In the 30s in the US, they started asking people every year, how many close confidence people can you turn to in emergency? And when they started doing it in the 30s, the average answer was 3. There were 3 people I can turn to. Now, since 2004, they still run that study, and now the most common answer is 0. People
really?
do not have anyone to go to in an emergency.
That's scary.
So it happens with this issue of loneliness and isolation, is it becomes a massive precursor for other issues. So if you're lonely, your life expectancy is 15 years lower. You also are much more likely to become clinically depressed. In fact, 7 of the 9 causes of depression are non-chemical. It's more about circumstances, environmental factors, and lack of social connection is a huge one of those. So that's the problem. And then the other hand is a solution, and what it looks like, that the antidote to loneliness is mutual connection. It doesn't look like someone helping someone because they're a doctor patient, because it's unequal. It's actually where common ground is formed. And when I was first exploring this problem, what might a solution to loneliness really look like, I managed to, as you do as a sort of when you're running a startup, I snuck my way into the Houses of Parliament, and I ended up going to this all-party parliamentary group on loneliness. UK is the world's first country to have a minister for loneliness, and what I observed was amazing. But there were millions of solutions out here. There were loads and loads and loads of solutions. Everyone's lobbying their solution. The problem is in connecting people who are lonely and isolated, and actually getting them into the services that will actually transform their lives, and which is where Joy comes in, right? It's a platform. This is something that we're releasing out to the ecosystem of things that are already going on, not as something to replace, but as something to enable.
Yeah.
And I feel like at the heart of the solution to loneliness, it's people connecting with people, supporting each other. And so that's what we've embarked on with Joy.
Yeah. So how is that? How do you use Joy? What is it?
Yeah. So it's essentially, it connects community organisations. In the UK, there are at least 45,000 that we've been able to find.
Yeah.
Friendly community-based organisations. Think your Age UKs, your Christians Against Poverty, all that stuff. It connects those organisations to people who are making a referral on behalf of somebody else.
Yep.
So just a bit of context. So in the UK, we're getting these things called social prescribers.
Yep.
And their role is to sit in GP surgery and refer people who have social health issues such as loneliness, isolation, or other ones, poverty, housing, into groups.
Yep.
And so the people who are the most vulnerable, the least confident, the most lonely, my hypothesis is possibly just giving them a tool and saying, you sign up, it's not going to be as effective. So you've got those social prescribers, but you've got people like me, who is maybe a family member or a friend of somebody else who is lonely or isolated. And it's a platform from which people like me and healthcare professionals can use to refer a client, a patient, a family member into a friendly community-based outcome service, and then we use the data to track the outcomes and work out, did it work, and did it reduce GP appointments, and how much, and stuff like that.
Yeah. Okay, so I think we're going to get kicked out of the room. There's someone that is looking to use the room. So we will take this back up, Lauren. You can do some cool editing. Okay, yeah, so now we're in the new room. How do you use Joy? Can I just download it? Where do I get it?
It's completely available to be downloaded. So our plan is that we will partner with local authorities and the NHS, who have an ambition to improve the well-being and do preventative health initiatives.
Okay.
So improve people's well-being and also reduce demand on their GP appointments, hospital admissions, referrals into adult social care. So we partner with them.
Yeah.
And then we build our marketplace. We'll build the marketplace around organisations like that. I just say that because our first local authority who we worked with is based in Berkshire.
Okay.
So we're currently most active in, hilariously, the happiest place in the entire country. The least lonely, most happy place. That's
because they've got Joy.
Some might say that it's because of Joy. And there's 160,000 people who are very well served by what we do. Obviously, our plan is not just one part of Berkshire, but of course across the create a nationwide platform that anybody can use. So we have a few things in London, not many, but one or two things. And if you wanted to, if you're someone who runs a service, anyone can list a service. On there, they have to just be approved by it. But if you're part of an organisation and you run an organisation and your service on there, you can definitely put it on there. If you're somebody who just runs something and you want to do an initiative, we can put it on there as well. It will just mean that most vulnerable people won't go into the sort of unverified listings and whatnot.
Yeah.
So if people want to use it, then they can download an app. They go to explorejoy.co.uk.
Nice.
And I'm sure that will be in something around the video.
Yeah. I'll have that floating around.
Yeah. The number one way is really if you work in public health, if you work in a local authority in CCG, then partner with us and we can pop it around that citizen, that population area.
Awesome. So if I just go to the App Store, I can download Joy for free, get on it, get set up, and get cracking.
Yeah, 100%.
Perfect. Okay, so in the next 5 years, where are you hoping Joy's going to be at?
Yeah, so quite frankly, over the next 5 years, we've got an opportunity to properly take a dent and put
take over London.
Get rid of loneliness. That's the long-term ambition, and prove it. So that's what we're trying to do. So we've built our product now. We've proved it in one part of the country, and so bringing it to London is so massively on our hearts. Like we want to be where the need is greatest, and London has a huge problem of loneliness and just general mental health and well-being. So desperate to bring it to London, but after 5 years, I would have expected us to have done London and scaled it to the
all over the
rest
UK.
of the country and beyond. It's a problem that affects all of the Western society. So definitely think there's opportunities to. There's a need there for other places to have a solution such as this. Have joy.
Yeah, it's a good name. So you mentioned getting local authorities and getting people to sign up. That's the next step, really. That's how we can all help you. We can get you to those local authorities, get you in front of them, get you an audience. Is that the sort of key thing to helping you now?
Here's like the reality of the situation. So my background is more about management consulting. Just with compassion went into this, and the other people in the team, ex-Apple, and point being, we're not from that world of health and social care. There is every single day 200 new apps for health released onto the App Store. So what I'm very, very aware of is there are a lot of startups, a lot of people like me trying to get in there, and we all believe, and I do too, of course, think we've got the next greatest thing that's really helpful. So the reason I say that is because probably one of the most helpful things is for people to recommend us, link us into different local authorities or NHS, people who are interested in the work we've done in one part of the country and might be curious about what it could do in there. That is the biggest area of support probably that we are working on.
Awesome. Okay, so the theme of this year's Mental Health Awareness Week is sleep. As a startup owner, founder, etc., how much sleep are you getting?
I don't get loads. I don't get enough. I reckon because I go to bed really early, but I just don't get to sleep that quickly. So I'm gonna say
Netflix.
But what is how much am I asleep? Do you know what I mean? So I reckon 7 hours, which isn't too bad.
That's a good level. That's a healthy. I thought you were going to say 3 hours.
Oh no!
That's when to be worried. But 7 hours.
But no, you need more apparently.
Most people can live with sort of 6 to 9. I'd class myself at the latter end.
So you're 9.
Not necessarily 9, but I need a lot more sleep. Otherwise, I get cranky.
It's about quality of sleep, though.
Yes, it is.
I'm not a good sleeper because I didn't wear it anymore. I had this Fitbit. And then
God, that tracks your up and down heart rate. No, I couldn't do that.
It would just tell me I'm really knackered the whole time.
And that makes you, apparently, if you have those tracking apps, it makes you even more antsy about sleep because you're constantly like, oh my gosh, how much am I getting? How do I get more? Whereas if you just let sleep happen, I think that's the kind of key. And I mean, sleep obviously hugely impacts your mental well-being.
Massive.
Makes you feel rubbish if you've not got enough, and obviously if you're feeling lonely as well, can exacerbate the symptoms. Well, thank you so much for sitting down and having a conversation. You heard it from Patrick. Get in touch if your local authorities, anyone, think you can help. Please help, because this is an amazing initiative and we really want to get it off the ground. So help this guy out, and you can hear many more stats, and I'm sure he can wow you and charm you as he has done all of us. So thank you very much.
Thank you.